Hello and welcome. My name is Chris from ChristopherHole.com and welcome to this video where we're going to be talking about non-specific low back pain and I guess a specific non-specific low back pain, if that makes any sense whatsoever. But again, this is something that when I'm in the gym, when I'm in the therapy room, that I tend to find happens more often than not. Obviously, sometimes it's not this problem and it needs further investigation, and that's how I recommend you treat this video. Check this out. If it is this, great, it will help. If you check it out, it's not what I'm talking about in this video, then go and seek some further advice from a medical professional, a physiotherapist, a chiropractor, an osteopath, someone that can bring more light to this subject of non-specific low back pain. So before we get into the bulk of the content in this video, just quickly mention my social channels on Twitter, which is at Christopher Hole, on Facebook, which is Christopher Hole Training, and on Instagram, which is Christopher Hole. Alternatively, come along to the website, onto ChristopherHole.com/join, put your name and email address in, get the free monthly newsletter, which is packed full of information based on anything health and fitness. We try to cover as much as we can on the newsletter, simply just to give you as much value as we can with regards to an education about your health and fitness, because then you can apply it into everyday life. So many thanks for listening to that. What we're now going to do is go back into the bulk of the video where we're looking at non-specific low back pain. Now, non-specific low back pain is defined as not attributed to a recognizable known specific pathology, e.g. any of these. 19 out of 20 cases are categorized as non-specifics. That's 96% of back pain. So as a general rule, most people that come to see me have non-specific low back pain. The other 4% can be categorized as specific low back pain from one of the above pathologies or a traumatic injury, i.e. a car accident, for example, or a fall of some kind. So they have some sort of traumatic impact on it and it causes low back pain from that. Otherwise, it could be from one of the above pathologies. So we are talking about a vast majority of people, which is 96% of the back pain that's out there. So what we're going to do is we're going to look a little bit more closely at what the anatomy is that can be involved. Now, in the next slide, that's what we're going to look at. Now, please have in mind, it could well be different than what I'm talking about. But again, as a general rule, this is the first place that I go to. This is the first place that I check out. If it's not this, then obviously I move to other areas. But this is the first place that I tend to look to try and understand someone who's talking about low back pain in that area of the back. So the anatomy of non-specific low back pain. The first place I go to look is the psoas muscle. And the main reason being is because it joins onto the first five, or the five vertebrae of the lumbar spine, L1 to L5. It also joins onto T12, and if you palpate and manipulate around that area, you will tend to get some degree of tension through there. So the psoas muscle, the origin or the start of it is the transverse process of T12 to L5, which is basically, if you look at this picture over here, you've got these knobbly bits on each side of the vertebrae. That's where the psoas muscle joins onto. These are called transverse processes. That's where the muscle joins onto. It then flows through or down the spine, through the pelvis, and then onto, which is the insertion, which is where the muscle finishes, which is the lesser trochanter of the femur, and the femur being the big thigh bone. So the muscle pain is often related to tension, overuse, or muscle injury from exercise or physically demanding work. So it's this muscle becoming fatigued. So when you work a muscle and you feel the burn, you sort of see that as a good thing because you're working the muscle. The only difference being is when this one becomes tense, it tends to radiate and sort of pull on the spine, if you will. And this tends to involve specific muscles during or just after activity. So what's generally happening is this muscle just becomes overworked and fatigued. So a part of my role as a sports massage therapist is to relax that muscle and use my soft tissue techniques that I use to be able to release the tension from that muscle and ease the pain in their back, if you will, because it's not necessarily a back issue. It's more a muscle, or the psoas muscle, just becoming fatigued. And like any muscle, when it becomes fatigued, it starts to become painful. The only difference being this is then pulling on the lower back, and then we call that lower back pain. So the main thing with this one is very much just adding a little bit of pressure. If you put your hand around your back and you feel your spine and you just go to the outside of it and you just prod around, you may find that there's specific tension through that area. And in general, it's the psoas muscle just becoming fatigued, overused, and therefore pain. So what I tend to do is I'll tend to release it using sports massage techniques. Then I'll stretch it, and then I'll move it for them. So they're then able, or I won't move it for them. We'll do some movements and some exercises that move that muscle, so then it's able to reduce any tension, reduce any stiffness that may be in there, and then relieve the pressure in the back. So it's a very simple video. It's a very simple way of treating, because it's a very simple injury, if you will, and it's a very common injury. If it's not what I'm talking about in this video, then please go and get it checked out by a medical professional, by a physio, by a chiropractor, by an osteopath. They may be able to investigate a little bit further and find out more about what is going on with your lower back pain. So many thanks for watching. My name is Chris from ChristopherHall.com. Please do come along to Twitter, Facebook, or Instagram, or come along to the website. Join the monthly newsletter. It'd be great to have you there, answer any questions that you may have. So many thanks for watching. My name is Chris from ChristopherHall.com. I'll speak to you in a future video.